Introduction. Welcome to today's lecture on the revolutionary field of medical nanotechnology and its applications in the field of rheumatology. Throughout this script, we will delve into various topics pertaining to nanomedicine and rheumatology, exploring the use of nanomaterials for targeted drug delivery, the significance of nanoparticles as imaging agents, the utility of biomimetic nanomaterials for tissue engineering, and much more. By the end of this lecture, you will have a comprehensive understanding of the role of nanotechnology in advancing treatments and diagnostics for rheumatic disorders. So, let's get started. Nanomedicine, the application of nanotechnology in the field of medicine, has opened up a plethora of possibilities in the management of rheumatic disorders. Rheumatology focuses on conditions affecting the joints, bones, muscles, and connective tissues, such as rheumatoid arthritis, osteoarthritis, and lupus. Nanotechnology provides a platform for targeted and personalized treatments, improved diagnostics, and enhanced regenerative therapies. In the context of rheumatology, nanotechnology enables unprecedented precision when it comes to drug delivery. Traditional drug delivery systems often lack specificity, causing off-target effects and limiting therapeutic efficacy. However, nanomaterials engineered at the nanometer scale can efficiently deliver therapeutics to disease sites, minimizing systemic toxicity. One of the most promising applications of nanomedicine in rheumatology lies in targeting medications directly to affected tissues. Nanomaterials, such as liposomes, polymeric nanoparticles, and dendrimers, have gained considerable attention due to their ability to encapsulate drugs and transport them to specific locations within the body. These nanocarriers protect the encapsulated drug from degradation and improve its bioavailability. Additionally, surface modifications of nanomaterials can facilitate active targeting of inflamed joints and tissues, enabling precise drug delivery. Such targeted drug delivery systems not only reduce side effects but also improve the drug's therapeutic response. Accurate imaging is crucial for the diagnosis and monitoring of rheumatic disorders. Traditional imaging modalities, such as X-rays and magnetic resonance imaging, MRI, provide valuable insights but often lack the desired sensitivity and specificity. Nanoparticles, due to their tunable properties, offer a novel approach in the field of rheumatology imaging. By conjugating imaging agents, such as fluorescent dyes or magnetic nanoparticles, to these nanomaterials, it is possible to enhance the visibility of inflamed joints and tissues. This enables early and precise detection of rheumatological disorders, leading to more effective treatment strategies. Tissue engineering holds immense potential in the regeneration of damaged tissues and organs. However, in rheumatology, the unique challenges posed by the disease microenvironments necessitate innovative approaches. Enter biomimetic nanomaterials. Biomimetic nanomaterials mimic the natural extracellular matrix, providing an ideal environment for cell adhesion, proliferation, and differentiation. By incorporating bioactive molecules, such as growth factors and extracellular matrix components, into nanomaterial scaffolds, researchers have successfully directed cell behavior towards tissue regeneration in rheumatic disorders. These nanomaterial-based tissue engineering approaches hold promise for the restoration of joint function and alleviation of symptoms. Early diagnosis and continuous monitoring of rheumatic disorders are critical for successful disease management. Nanosensors, with their highly sensitive properties, offer a new frontier in detecting biomarkers associated with these conditions. Nanosensors, typically designed as nanoscale devices or nanostructured materials, can detect specific disease-related molecules in bodily fluids or tissues. They provide real-time monitoring, enabling clinicians to assess disease progression and therapeutic response accurately. By leveraging nanosensors, healthcare professionals can initiate timely interventions and tailor treatment plans, leading to improved patient outcomes in rheumatology. Rheumatoid arthritis, RA, an autoimmune disorder characterized by chronic inflammation of joints, poses significant challenges in treatment. However, nanotherapeutics offer innovative solutions to combat the complex nature of RA. Nanotherapeutic strategies include the encapsulation of disease-modifying drugs, such as methotrexate or biologics, within nanocarriers for targeted delivery. These nanocarriers can protect the drug payload from degradation and enhance its accumulation at inflamed joints. Furthermore, surface modifications or functionalization of nanocarriers enable immune modulation, improving the therapeutic response in the context of RA. Nanotherapeutics hold promise for alleviating pain and inflammation, as well as preventing joint damage in patients with RA. Many therapeutic agents used in rheumatology have limited solubility or stability, which hampers their efficacy. Nanotechnology provides a solution by enhancing the bioavailability of these drugs through the use of nanocarriers. Nanocarriers, such as polymeric nanoparticles or lipid-based structures, can efficiently encapsulate hydrophobic drugs, improving their solubility and stability during administration. These nanocarriers protect the drug payload from degradation and facilitate its transport across biological barriers. By increasing the bioavailability of rheumatological drugs, nanocarriers enable more effective treatments with reduced dosages and fewer side effects. Autoimmune rheumatic diseases, including systemic lupus erythematosus and Sjögren's syndrome, result from dysregulated immune responses targeting self-tissues. Nanoimmunotherapy offers a unique approach to modulate aberrant immune responses and restore immune homeostasis. Nanoparticles can be engineered to selectively target immune cells involved in autoimmune reactions. These nanoparticles can deliver immunomodulatory agents, such as cytokines or immune checkpoint inhibitors, directly to the affected tissues. By regulating immune cell function and suppressing inflammation, nanoimmunotherapy holds promise for managing autoimmune rheumatic diseases and improving patient outcomes. Surgical interventions play a crucial role in the management of severe joint damage caused by rheumatic disorders. Nanotechnology offers exciting opportunities to enhance surgical interventions and optimize patient outcomes. Nanotechnology-enabled surgical interventions involve the use of nanomaterials, such as biodegradable scaffolds or nanoparticles, to promote tissue repair and regeneration. These nanomaterials can be incorporated into surgical implants or delivery systems, providing localized drug release and supporting tissue healing. Additionally, nanotechnology enables minimally invasive approaches, such as nanoparticle-guided or nanorobotic-assisted surgeries, to improve surgical precision and minimize postoperative complications in rheumatology. Gene therapy holds great promise in the treatment of rheumatological disorders by targeting the underlying genetic and molecular mechanisms. Nanoparticle-mediated gene delivery systems offer precise and effective strategies to deliver therapeutic genes into target cells. Nanoparticles can protect therapeutic genes from enzymatic degradation and facilitate their transport across cell membranes. Surface modifications of nanoparticles can enable specific targeting of cells involved in rheumatic disorders, enhancing the therapeutic payload's uptake and reducing off-target effects. Nanoparticle-mediated gene therapy has the potential to correct genetic abnormalities, modulate immune responses, and promote tissue repair in rheumatological disorders. As with any advancing field, it is crucial to address the potential risks and safety concerns associated with nanomedicine. Nanotoxicology aims to understand the effects of nanomaterials on biological systems and develop strategies to mitigate any potential harm. In rheumatology, nanotoxicity studies have focused on identifying the impact of nanomaterials on cellular functions, inflammation, and tissue integrity. Proper characterization, biocompatibility evaluation, and dose optimization are essential to ensure the safe and effective use of nanomaterials in rheumatic disorders. Studying nanotoxicity enables researchers to improve nanomedicine's safety profile and develop guidelines for clinical translation. The future of nanomedicine in rheumatology holds immense potential for transforming patient care. Ongoing research and development efforts aim to further refine nanomaterial properties, improve targeting strategies, and enhance treatment outcomes. Advancements in nanotechnology, such as the integration of artificial intelligence, robotic-assisted surgeries, and in vivo imaging techniques, will revolutionize the diagnosis, treatment, and management of rheumatic disorders. Furthermore, the emergence of personalized medicine supported by nanotechnology will enable tailored therapies based on individual patient characteristics, leading to improved clinical outcomes and quality of life. In conclusion, nanotechnology has emerged as a game-changer in the field of rheumatology, offering innovative approaches for targeted drug delivery, enhanced imaging, tissue engineering, diagnostics, and surgical interventions. The integration of nanomaterials and nanodevices holds promise for advancing treatments, improving patient outcomes, and ultimately alleviating the burden of rheumatic disorders. As we move forward, continued research, collaboration, and interdisciplinary efforts will pave the way for a brighter future in nanomedicine for rheumatology.